So, welcome ladies and gentlemen. In the following few minutes, please, let me introduce my progress in my PhD topic, which is about translational approach for better awareness of cystic fibrosis-related glucose abnormalities. As well as I'm a PhD student, I'm also a clinician who is involved in the clinical care of children with cystic fibrosis. Therefore, my vision and my mission is to improve the life quality of these children by applying up-to-date scientific results in the clinical assessment of cystic fibrosis-related glucose abnormalities. To estimate the significance and to assess the prevalence of abnormal glucose toleration in the cystic fibrosis population, we are conducting cohort analysis and meta-analysis. With the meta-analysis, we would like to know the prevalence of abnormal glucose tolerance in patients with cystic fibrosis. The life expectancy of patients with cystic fibrosis increased in the past decades thanks to new therapeutic options. Therefore, complications that need time to evolve have come into light, such as osteoporosis or cystic fibrosis-related diabetes. The diagnosis of diabetes is associated with increased mortality, which can be avoided by early recognition and treatment. By the age of 40, approximately half of the patients have cystic fibrosis-related diabetes. But we have to think about diabetes as the end stage of a progressive disease, the abnormal glucose tolerance spectrum. Before diabetes, there are prediabetic conditions, such as impaired glucose tolerance. Basic scientific research suggests that this prediabetic condition starts at early ages. Despite that fact, oral glucose tolerance test, which is the gold standard method for diagnosing abnormal glucose tolerance, is only recommended after the age of 10. And therefore, characteristics and dynamics of the progression in the abnormal glucose tolerance status is still unclear. That's why we would like to know the exact prevalence of abnormal glucose tolerance in different age groups of cystic fibrosis, especially under the age of 10. We hypothesize that abnormal glucose tolerance is more prevalent under the age of 10 in patients with cystic fibrosis compared to a non-cystic fibrosis population. After the systematic search and the selection process, we have found 1,000 eligible conference abstracts and articles, and due to the large amount of eligible studies, we haven't finished the data extraction yet, but I would like to show you preliminary results from 435 studies. Firstly, we investigated the prevalence of abnormal glucose tolerance in different age groups of cystic fibrosis. As you can see, the heterogeneity is quite large in every subgroup and in our further outcomes as well. It could be due to the fact that we haven't applied any restriction nor on the study types nor on the cystic fibrosis population. So conference abstracts are as involved as articles or small observational studies as large registry data, and we involve the super-selected cystic fibrosis population such as lung transplanted patients. According to the preliminary results, the prevalence of abnormal glucose tolerance in the pediatric cystic fibrosis population is 37%, among the adults is 49%, and in the overall cystic fibrosis population is 40%. When we look at the data about the global prevalence of abnormal glucose tolerance in an average pediatric population or in an average adult population, we can see that the abnormal glucose tolerance is more prevalent in the cystic fibrosis population compared to these age-matched average populations. And when we further divided the pediatric population by age, we can see that abnormal glucose tolerance is highly prevalent even under the age of 10 with 23%. Secondly, we examine the prevalence of diabetes in different age groups. As you can see, the prevalence is 9% among the children, 28% among the adults, and in the overall cystic fibrosis population is 17%. When we look again at the global prevalence data about diabetes in an average pediatric population and in an average adult population, we can see it's in cystic fibrosis, the diabetes is more prevalent compared to these age groups. And when we further divided the prevalence of diabetes by age in the pediatric population, we can see it's highly prevalent with 2% even under the age of 10. Of course, this meta-analysis has its strengths and limitations. is the first meta-analysis in this topic, including high number of studies with high number of cases. But the definition of the outcomes and the age groups are not equally detailed in all of the studies. And we can see a high heterogeneity, which is due to the involvement of the cystic fibrosis superselected population. But with subgroup analysis, we can learn further knowledge about the superselected cystic fibrosis population. In conclusion, we can say that abnormal glucose tolerance is more prevalent under the age of 10 in patients with cystic fibrosis compared to a healthy population, even under the age of 10. Every 4 children with cystic fibrosis under the age of 10 have abnormal glucose tolerance. 8% of them had cystic fibrosis-related diabetes. Those 8% have already lost the possibility for early intervention and treatment, which can have slowed down the disease progression and maintain a better life quality. Therefore, better awareness is needed for screening abnormal glucose tolerance in cystic fibrosis, especially under the age of 10. It's time to reconsider the current guidelines and start oral glucose tolerance tests younger than the age of 10. And there is a burden desire for develop a patient-friendly screening method which is suitable for diagnosing even toddlers who cannot drink the sugary liquid. Well, what is the exact proportion of abnormal glucose tolerance in the pediatric population in Hungary? That's a question we would like to answer by analyzing the data of the cystic fibrosis-related pancreatic disorder registry. This is the main aim, to assess the prevalence of abnormal glucose tolerance in our registry patients, especially under the age of 10. Currently, 91 patients are involved in the registry, from whom we analyzed those 78 patients who were able to undergo oral glucose tolerance tests or who were previously diagnosed with diabetes. The further goal of this registry is to examine the characteristics and dynamics of the progression in the glucose tolerance status by yearly follow-up visits and by yearly re-evaluating the abnormal glucose tolerance status. As you can see, half of the patient has 2-year follow-up visits and a quarter of patients have 1-year follow-up visits. By analyzing the baseline data of those 79 patients, we can see that according to oral glucose tolerance test and further examinations, the prevalence of abnormal glucose tolerance is around 30–40%, even under the age of 10. And under the age of 10, the prevalence of diabetes is 9%, which increases by age to 30% in the teenage population. Here you can see the table with the 4 glucose tolerance status, the normal glucose tolerance, the terminal glycemia, and the impaired glucose tolerance and the diabetes. And you can see the basic characteristics of these patients. As you can see, the more progradiated is the glucose tolerance status, the worse the lung function and the bacterial colonization. As you can see by looking at the forced expiratory volume parameters or the tendency in the chronic Pseudomonas aeruginosa infection. So we can say that our results in our registry analysis harmonize with the results of the preliminary meta-analysis results, as both highlights that abnormal glucose tolerance is prevalent in cystic fibrosis, even under the age of 10, in which age group the oral glucose tolerance test is not mandatory, but we have to highlight that the early recognition of this abnormal glucose tolerance is important, as an uncontrolled glycemic status leads to rapid clinical decline. And however beautiful the strategy, you should occasionally look at the results, and that was their occasion. Thank you very much.
My question is regarding to your second project. You mentioned that patient-friendly screening method is needed for toddlers. Have you gotten any idea for this? What can be used?
Thank you for your question. Yes, there are plenty of studies which investigated the relevance of continuous glucose monitoring, the tissue glucose sensor, but there are no clear cutoff for the diagnosis of the different abnormal glucose tolerance status, but it could be the future.
You talked about super-selected populations. What do you think the prevalence would be for diabetes for them? For example, pregnant patients or transplanted patients? And the second one would be considering your clinical trial, if you consider the continuous glucose monitoring or other daily random checks for blood glucose level in case OGTT cannot be performed.
Thank you for your questions. To answer your first question, we expect a higher prevalence of abnormal glucose tolerance, for example, in transplanted patients or pregnant patients, which we know is a predisposing factor for diabetes as they start, for example, corticosteroids after the lung transplantation of pregnancy is a predisposing factor for diabetes. But such as cystic fibrosis translator, so the CFTR modulators can reduce the prevalence of abnormal glucose tolerance, and it would be an interesting question to examine. And to answer your second question, we plan a clinical trial on continuous glucose monitoring.
Regarding to your second project, you mentioned you diagnose abnormal glucose tolerance with OGTT and other further examinations. What do you think on further examinations?
Thank you for your question. When we did the OGTT, we highlighted those patients who had more than 2 interim blood glucose level higher than 11. And we examined them further on our endocrinology ward by 12 times a day glucose measuring, which was conducted preprandial, postprandial 2 times at night, and with the further consultation with an endocrinologist.
I wonder if there are any data out about the different CFTR mutations, since we don't fully understand, how CFTR affects actually different diseases. So is there any data on those that you can identify that which leads to diabetes in a higher prevalence or not?
It's not reported yet, but we are currently try to examine the different mutation forms if we have enough data, but hopefully we'll have enough data from these thousands articles.